to another country with a particular regulated product, we are assuring the receiving country that it will be of quality. That's not what is happening. Most of our medicines come from Southeast Asia, and they belong to the member states too. We have a scheme where before medicines that we have approved leave that part of the world, we do pre-shipment testing. And that pre-shipment testing is supposed to come with certificate of pharmaceutical product. Meaning, it's supposed to assure us that what we are getting is good. But that's not the case.
All right, so that is what we're going to find out now. And the Director General of NAFDAC joins us here in the studios, Professor Mojisola Ade. Good morning, and thank you for coming on today.
Thank you so much for having me.
So, definitely we're all concerned and worried, hoping that we all get it right, because you know the impact if we don't. What's going on with what you said there?
Actually, what I said was the product that could have come to Nigeria, we stopped such products from coming in through the pre-shipment testing in the country where the products are living from. So it could have been misunderstood. What we have in NAFDAC is what some other countries are copying now, pre-shipment testing. So let's say we approve 100 products from that part of the world. Those products must go through a clean report inspection analyst, CRIA, before coming. Those that failed will not come. And that was what I was referring to. That those that failed, and these are products that we've already approved. But if fake documentation was part of the submission, we wouldn't have known. But at that point where the products are being tested, we found out that they failed, so they couldn't come to Nigeria. None of those products came to Nigeria. About 140 approved products. And when you talk of approved products, you are talking of 5-year approval. So it will be tens and tens of containers over the 5 years. We stopped those products through the pre-shipment testing. However, we dug deep, we did a deep dive into the documentation that accompanied those failed products. One of those documents is certificate of pharmaceutical product. And we found out that over 50% of the documentation was fake.
Wow.
For those that didn't come. So despite the fact that we have approved them based on what we saw, they failed. So they couldn't be shipped into the country.
How did you discover that they were fake?
Well, we have network. You know, the certificate of pharmaceutical product is supposed to be given by the Central Regulatory Agency in India. But that is not usually done. So the states or the provinces have their own, unlike us, that we have just one single NAFDAC. The states also have their own regulatory agencies. So the states are the ones that issue this COPP. So one of our colleagues dug deep, that know India very well, dug deep into certificates of pharmaceutical products that we sent to them because they wanted to know more about our pre-shipment scheme. And they were the one who discovered that over 50% of the documentation is fake. So it is not products that came into Nigeria. No, we don't have over 50% of our drug products in Nigeria fake. No, we have about 12%, which we are trying to reduce to less than 5%.
Well, I can tell you that initially when I heard that statement, it was alarming. And I think that's what a lot of people heard. They thought they heard that was the products, the drug products that came into Nigeria that were fake.
No.
It is upon closer listening that you hear, oh, certificate, documentation, over 50% of them were fake.
Yes.
So it's a good thing you clarify that it is a documentation, but then you also say it is a pre-shipment
before they ever got out of the country where they are being shipped from. So they never got to Nigeria at all. It was just that we now found out that aside from failing like a drug release test, disintegration test, dissolution test, like tablets, aside from failing in the lab, their documentation is also fake.
So, ma'am, can you tell us, because to be very honest, I am curious. I was particularly worried because at the time I heard that, was watching a particular story, I was taking medication. And are you sure what I'm not taking is one of the 50%? You never can tell. But can you tell us how the process works? Because you said, and I understand, that it is important to reassure Nigerians that, the medicines that have in most of the shelves in our pharmacies are safe for consumption.
Yes.
However, we do not want that to be on a false premise. We want that to be something that is genuine.
Yes.
So can you tell us what the process is like? Because you said that those drugs, even though you later found out that the certificate or the certification, 50% of them were fake, had been initially approved.
Yes.
So how is it that you were able to approve something first, then you find out later on that the documentation is fake?
That's a very good question, first of all. To authenticate that COPP, we demand that they go to our embassies in the country of export, where they're coming from, to certify it. Very likely, there is a doctoring of that certification. And what we are trying to do now is to digitize the authentication. Because I may be speaking to you now coming from India or China or whatever, and I will be talking with you face to face. And you'll be showing me your certificate of pharmaceutical product. And I'm here in Nigeria. You are there in China or wherever. All these things will be videotaped.
Oh, it's a virtual communication?
That is what we're trying to do now. We want to digitize it. Instead of going to the embassy, we're not sure whether they even went to our embassy. They might have faked it. I don't know. But we don't. And we also vet it. Once we get that COPP, we vet it through our own legal department. But you cannot know what is doctored because it's coming from another country. Now we are digitizing authentication of the certificate of pharmaceutical product. So that is going to help a lot.
Okay, sorry, I didn't quite catch this. The approval. If a medicine is to come into Nigeria, it has to get an approval first? Is that correct?
Yes, yes.
So how do you get the approval first before you now begin to pursue documentation?
Wonderful. It takes at least 12 months to get full approval. It will go through the dossier review. Dossier is the package, The dossier is like a Bible or whatever. It's divided into chapters of quality, safety, efficacy. The applicant must submit that to us through our electronic platform. Then after the dossier is approved, finally it may take a few months to get approval. It goes into another leg of our electronic application where they will now go for GMP inspection review, because it's not just the quality, safety, and everything that is put in. We need to know the record of this company in terms of good manufacturing practice.
So is it the medicine itself that goes through this, or the documentation that accompanies the medicine?
The application goes through this system.
Does the application include the medicine
At the beginning, it will not. It is at the good manufacturing practice stage that will go there for inspection and then take samples.
Okay.
Once we test those samples in the laboratory, then the 3 arms of the approval process have been satisfied, which is the dossier review, the good manufacturing practice inspection, and the laboratory testing.
So at what point do you determine then that this medicine, is approved? And then at what point do you now say, oh, no, the certification that accompanied it is fake?
Okay. First of all, it is at the initial stage that we determine that or that we assess the documentation. Then it goes to the GMP, or Good Manufacturing Practice Model, and then to the laboratory. We will have approved or certified through our own legal department that all these documentations are good.
Okay.
Yes.
I want you to be able to talk to you, DG, about fake products in the country. I've gone on a few raids.
Yes.
With your office and your men. Very troubling most of the time. I remember the last time I went with your team for a raid was at Suleja.
Yes.
And it was those little aphrodisiacs that they were selling.
That's right.
And I also heard you talk about a clampdown on alcoholic drinks in sachets.
Yes.
Talk to us a bit about fake products within the country, because that's something that a lot of people are worried about. What's been done when we go on these raids? One thing I do notice is that we catch the store boys.
Yes.
What about the barons, the ones who are importing these things? What's really happening in that area?
Unfortunately, we usually don't get the barons. We get the foot soldiers, so to say. But once in a while, we catch the big guys too, and we prosecute. NAFDAC has investigation and enforcement directorate. And also the Federal Task Force is also domiciled in NAFDAC. So we have a lot of backing by the law to prosecute, to arrest, to destroy and all those things, violative products. But in terms of drugs and food, we have a lot of challenges on that, because of our massive population, because of the 5 countries that border us. But what we do is what we call market control. Market control is one of the models for which we were benchmarked as ML3. That is, we have 9 models to get to ML3, and market control is one of them. Market control starts with registration. What do you do after registration? In our own case, pre-shipment testing. Then, if the product passes, it comes into the country through our port inspection. We go and inspect the warehouse or the distribution site to make sure that it's not fake or whatever, and then it goes into the market. Then we have the post-marketing surveillance directorate, where we do routine inspection. We do mystery shopping. I've sent people out for mystery shopping in different parts of the country. Check this out for us. But there is a directorate that does that on a daily basis, just to be sure that what we approved, they've not changed it on us. I was told that a company here wanted to launch a product. Before that local manufacturer launched it, they've already cloned it in China. So this is the challenge that we face every day. But there's nothing we can do. We have to step up and devise all sorts of means. There are so many methods to step down or mitigate substandard falsified medicine. The first one is this pre-shipment testing. Once they get into the country, we do track and trace.
Okay. Because part of the concern was that, as at the time the information came through that about 50% of the documents were fake, many then thought, wait a minute, does it mean that chances are that some of those documents, if you hadn't gotten that tip-off, might have been approved here previously? Actually,
we approved here previously.
So
it is only one of those documents that failed. We have a lot of documents that accompany application. It is only the COPP that comes from the exporting country
and
that
so
failed.
If those were approved previously, chances are that some of those drugs too may have equally been approved and gotten into the country.
No, possibly. The chances are very minimal, first of all. That is why we have a lot of safeguards. For example, we have what is called the PID camps, the port inspection portal, where we can actually trace where products are coming from on the sea.
So, if those documents had gotten into the country and the drugs had gotten in,
yes,
what were the chances that we could have caught them there?
That is where the post-marketing surveillance and the enforcement comes in. We get a lot of intelligence report. In fact, many of our big breaks are from intelligence, that a company is making the X product and all of a sudden there is X prime product. The same thing, faking it. The companies also are at alert. We expect them to have post-marketing surveillance department to be also looking out for their product, branding. And sometimes we get tips from such.
Are you satisfied with the agency's capacity for lab tests to check all these drugs to come in at every part of the country?
That is a great question. We have thousands of products. I mean, thousands of products that we regulate. We cannot test all the thousands of products. That was part of what they saw in our system when WHO first came, that people must be running crazy in your lab if you think you're going to test all these products. So they advised us use risk-based sampling, risk-based testing. For example, if you have been an importer and you have been complying with all our regulations and whatnot, and we tested 1 year, it passed your product, next year it passed, consecutively it passed. We put you at low risk. If your product is not on soft tissues, it's not sterile products, it is not a drug that can easily break down, we put you on low risk. Meaning, we will not test your product until the market. Meaning, we were doing test and register. And that was killing us. So with this risk-based sampling, for low risk, we don't test, but we have a lot of parameters that determine which one is low risk, which one is high risk. We just don't do it anyhow.
So you sorry, just one moment. It means you rest on the integrity of the importer
as one of the factors. There are about 5 or 6 factors. For example, if it is eye drop, it doesn't matter whether he has the best record. We're going to test. If the drug oxytocin, for example, for labor induction, if he has oxytocin, we're going to test because it breaks down very fast because of storage, not because it is fake. So it depends on the type of medicine. So we do risk-based sampling, and this is global now. To be a matured organization, you have to have risk-based sampling or testing.
I wanted to find out, how can Nigerians help? What can we do? Apart from the fact that a lot of us have gotten very used to now checking, labels on everything that we see.
Yes.
How can we help this fight against fake products in the country?
It's a community effort. It is a community effort. First of all, we have to engage our population almost on a daily basis. About 50% of us are illiterate. People don't read. We have to use social media because many of those that cannot even read so much, they have social media, whatever. We have to do a lot of awareness. Many of these things that we do, you don't see it in stringent regulatory countries because they are so much, they are well, what will I call it? They are socially conscious of what they are doing, and they are educated more than us in terms of drugs and whatnot, because you can go to the university and still not be educated if you don't want to. So it is that sensitization of the public. And we have measures because of what is going on. We, for example, before we started our traceability, we do the scratch and call, the mobile authentication system for anti-malarials, antibiotics. We were doing that. Now we are doing much better now with traceability, where you, in a few years, get ready your phone. You use it to scan the barcode. It's genuine. It's not genuine. So it's going to be much easier. But we started during the pandemic with vaccines. We commissioned all the vaccines that came into the country. We know right now where millions of vaccines that came into the country are, where they were given. It's a map. You see it, beautiful tree map of Nigeria, showing cities, health centers, and so on. So that's what we do. We also do on-site testing. Testing, I will call it testing, or detection. It's almost like a cell phone. You put your tablet on it, and it will show you, okay, this is paracetamol. But before we had that, NAFDAC was the first agency before my time that actually had that true scan. But it will say, oh, it's paracetamol. It was qualitative at that point. Now it is quantitative. So it will say, oh, it's 70%, it's 100% now. So we bought those, but it has a lot of what I call chemometrics. So our staff are getting trained in that. So that is one. Another is local manufacturing. Local manufacturing. We can easily get to our local manufacturer compared to companies overseas. We got a tip that a manufacturing site was not complying. Within 2 hours we were there. We shut them down. So that is, there are so many means of mitigating falsified medicine.
We'll keep working with the agency and any agency that wants to do their best to ensure Nigerians are safe.
Thank you.
So we do thank you, and we encourage you to keep doing as much as you can, and we will also do our part to ensure that the country is as safe as possible. Thank you for coming on, and all the best to you.
Thank you so much. Thank you.
Thank you for coming on, Mom.
Thank you.
Well, back in a moment, everyone. Stay on with us.
Yeah.